Hello family, welcome to another beautiful edition of Annie Otter's vlog. If today's your first day watching me, you are welcome. Please follow me, subscribe, okay? If you're a returning fan, thank you so much. I really love and appreciate you. So please do not forget to like, share and comment on my videos. So guys, in today's edition, we are going to be zooming into health, and we are zooming into the 10 most leading causes of death worldwide. You know, when America presented statistics, it's a kind of a yardstick all over the world, because the other third world countries and other countries might not have a very concise and precise and adequate statistics like Americans do. So that's why we use America as a perfect yardstick, okay? So according to the Center for Disease Control and Prevention, CDC, in 2021, this is their data, okay? Their mortality data. We're narrowing it down to the first 10. Number one is heart disease. So in 2021, heart disease claimed the lives of 695 people, 547. So that's about 20% of deaths that happened in 2021 caused by heart disease. So heart disease is a range of conditions that affect your heart and your blood vessels. Examples of heart disease include cardiac arrhythmia, that means irregular heartbeats, coronary artery disease, heart defects. All of these are categorized under heart disease. So how do we prevent heart disease? How do we prevent it? If you're smoking anything smokable, please quit. If you haven't started, never start. Another one is to eat healthy. Eat healthier than ever and exercise at least 30 minutes a day. Another one, hey, especially our Igbo people in Nigerian community, if you eat a lot of nkwobi, you need to slow it down. Eat once a month. And again, do not overeat it, because there are so many things that goes into that nkwobi. We need to be very careful. If you're a little chubby, please lose weight. Lose weight, okay? Because heavy body weight goes with heart issues, okay? So these are the ways to prevent heart disease. Number two, cancer. The second leading cause of death, according to the list, is cancer. So cancer claimed the life of 605,213 people's life in 2021. So that's about 17% of people died from cancer in 2021. This includes all kinds of cancer. So cancer is as a result of rapid and uncontrolled cell growth in the body. So risk factors for this cancer sometimes is genetic. Your family has certain type of cancer. Sometimes it's just your age, use of tobacco and alcohol, exposure to radiation, and a lot of sunlight. Yes, that will cause skin cancer. Then chronic inflammation, obesity can also cause cancer. We need to be very careful. So when it comes to women, breast cancer is the leading, while prostate cancer is for men. So we need to be careful about cancers. So prevention of this cancer is to stop smoking, exercise regularly, lose weight, avoid direct sunlight exposure, have a regular cancer screening if you are at certain age. So when you visit your doctor, make sure you have a discussion about cancer screening. Number three, COVID-19. Yes, so you cannot talk about the history of leading cause of death without mentioning COVID. So we know how COVID-19 dealt with people. It was an eyesore. For me, being in the medical field, I was scared of my life. COVID took the life of 416,893 people in America alone. COVID took the life of 12% of people. And COVID, of course, is still in the circulation. So why we don't hear much about it today is because of the vaccination all of us have taken. That's why we can bravely, majestically walk around with or without mask. But again, prevention is better than cure. If you know you are going to be in a very clustered place, wear your mask, okay? Because COVID is making a comeback and in a different way. Get vaccinated, wear your mask where and when necessary. Practice adequate hand washing. Number four, accidents, unintentional injuries claim the life of 224,000 people, 935 here in America in 2021 alone. That's 6.5% of lives went by accidents alone. So again, accidents are unintentional, like falls, motorcycle accident or unintentional poisoning. All these things are considered to be accidents. So again, how do we prevent this? Be careful in dealing with things, your actions. Be cautious about your surroundings, and also take adequate precautions when riding your bike or when driving, because there are so many crazy people out there. So be careful when you're out there or at home. Don't fall, don't have accidents, drive safely, buckle up. That's a way to avoid all these intentional deaths. Number 5, stroke, that's cerebral vascular accident, CVA. So this occurs when blood that flows in the brain has something like a blockage, okay, or a burst. That's when people will have stroke. In 2021, stroke claimed the life of about 162,890 people's life. Okay, so that's 4.4% of people here in America die from stroke. We need to be careful. Again, US is being used as a yardstick because other countries don't have adequate statistics like we have it here. Everything is documented appropriately. Let's understand that stroke happens more in men than women, so we need to be careful. So the risk factors, sometimes age, another one being a man, another one being diabetic, having high blood pressure, having heart disease. People who smoke, okay, they are prone to having stroke. In women, people who use birth control are sometimes prone to having stroke as well. So again, how do we prevent it? Treat every underlying heart disease, okay? So prevention is better than cure. Maintain adequate body weight. Eat healthier than ever. So exercise at least 30 minutes a day. Again, manage your blood pressure well, your blood sugar, manage it. Stop smoking, stop drinking, and maintain a good blood sugar level. That's the way to just stay away from all these things. Do the much you can. Number 6, chronic lower respiratory disease. That means your lungs, okay? What happens in your lungs counts a lot as well. So in 2021, chronic lower respiratory disease claimed the life of about 142,362 people. That's 4.1% of lives in the United States die from lungs-related disease. That's a lot of people. And this is very common among women. So what do we do for people over 60? Be careful, that's a risk factor. And people that have history of smoking, yes. And people that have history of being exposed to secondhand smoking. That means somebody is smoking and you're breathing it. That's secondhand smoking. People that have history of asthma, sometimes they end up having COPD. So we need to be very, very careful. People that smoke, they end up having COPD at their latter ages. So we need to be very, very careful. And statistics also shows that people that live in low-income communities, low-income household, low-income families also have the risk of having respiratory issues. So we need to be very, very careful. So what are the examples of chronic lower respiratory disease? Example is chronic obstructive pulmonary disease, that's COPD, emphysema, asthma, pulmonary hypertension, lung cancer. All these things will lead to chronic lower respiratory disease, and that is not good. To prevent these issues, please avoid tobacco smoking or tobacco chewing, and also exposure to secondhand smoking. If you're smoking, please quit and treat every respiratory infection very, very adequately and promptly. Number 7, Alzheimer disease. So in 2021, Alzheimer disease claimed the life of 119,399 people in the United States of America. That's very, very high. And that's about 3.4% of death in 2021 was caused by Alzheimer disease. And Alzheimer disease is more common among women. Ironically, it's very, very high, very, very common among women and people over the age of 65. Some of these people also have the history of dementia or Alzheimer's disease in their family. And the risk factors for Alzheimer's disease includes age, person's gene, lifestyle, and environmental input and exposure. Over time, it will start doing you rico in your brain, and those things you smoke will also kind of manipulate your brain negatively. So how do we prevent this? Exercise more often, eat healthy, and challenge your brain, okay? Play puzzles, do things that make you think. Exercise your brain by thinking positively, and also playing games that stimulate your brain. Do all that. Read books, do tasks that are challenging, that are stimulating to your brain, that make you think, chase cards, all those things. Please do them. They help you to bring your memory back, to challenge your brain to think deeper and more. Okay, so do not just not motivate your brain and let the cells die. Keep motivating your brain. Number 8, diabetes. Oh my goodness, diabetes. So diabetes claimed the life of 103,294 people in America in 2021. That's a lot of people dying from diabetes. About 3% of deaths that happened in the United States were caused by diabetes. So what are you doing? Treat your diabetes. Please take your medication, check your blood sugars, eat healthy, lose weight, exercise. Know your category. You need to know what type of diabetes you have, because we have 1 and 2. So diabetes 1 is the type that is more like family history, and it starts way early in life. At the age of 4, 7, you see people facing certain things. Again, that means the pancreas is not producing enough insulin. Then diabetes 2 is the one that starts when people are kind of overweight, when people are over the age of 45, and again, family history is there too. Okay, so the person becomes resistant to insulin, or unable, or the insulin is unable to control the blood sugar in your system. That's when you need to know things are not going right. So to prevent this, please maintain good body weight, eat healthy, exercise, check your blood sugars regularly, take your medications as ordered. Even when you're praying, please still take your medications until the doctor declares you healed. Do not say your pastor declared you healed. I'm not a person of little faith, but again, that's why the doctors are there. Let's be careful. Number 9, chronic liver disease and cirrhosis. So this claimed the life of 56,585 people. That's 1.6% of death in 2021. They died from chronic liver disease and cirrhosis. So chronic liver disease and cirrhosis are very common among people who drink alcohol excessively. In certain situations, people who have viral hepatitis infection can have accumulation of fat in their liver. So that's what we call fatty liver disease. That can also drive the person to have chronic liver disease and eventually cirrhosis. Anyway, so again, we need to be careful. How do we prevent this? Quit drinking alcohol. Seek help. Go and seek support group, okay? Go to rehab. You got to quit drinking. Otherwise, you're going to kill your liver and you will develop liver disease. So number 10, nephritis, nephrotic syndrome, and nephrosis. What am I talking about? All these things are related to kidney. All 3 of them, nephritis, nephrotic syndrome, and nephrosis. They're all about your kidney. So when you hear nephro, you're talking about your kidney. So in 2021, this claimed the life of 54,358 people. That's 1.6% of deaths in the United States in 2021 were caused by kidney issues. Risk factors are other chronic conditions such as diabetes, hypertension, recurrent kidney infections, smoking, overweight, obesity, family history of kidney diseases. All of these can make your kidney go into issues. So nephritis simply means kidney infection, kidney inflammation. Nephrotic syndrome is just your kidneys producing high levels of protein in your urine due to kidney damages. So nephrosis, of course, is kidney failure due to physical or chemical changes of your kidney. Okay, so how do we prevent this? Lower your sodium intake, salt intake, lower it. Stop smoking, drinking, drop it. Okay, lose weight. And again, if you have diabetes, make sure you get adequate care. If you have high blood pressure, make sure you get adequate care. By then, your kidney will also function better. And of course, drink water and drink good water. Take care of yourself. Have your annual checkup, okay? So that if anything is happening, it will be caught on time and taken care of on time. So, ladies and gentlemen, as I mentioned earlier, America has a very detailed mortality database. So that's why we are using America as yardstick to other countries who don't have database. So certain things of this nature are happening over there too. Again, these are the most 10 leading causes of death in the United States as of 2021. So another way to prevent all of this is to share this information, share my videos, share the news, okay? So that every one of us will be able to take care of ourselves in most possible way to do it, because prevention is better than cure. We cannot wait until we fall sick, until we have one of these diseases, then we start running hater-skater. The earlier the better. Let's make haste while the sun shines. Please like, share, and comment on my videos. Thank you so much for watching another beautiful edition of Annie Otter's vlog. I'm your girl, Annie Otter. I love you. Bye, guys.